Hey, hello and welcome everybody. I appreciate you joining me for this week's webinar. We're excited to be able to sit down and talk about regenerative medicine and where we're at with stem cell therapy, and even talk a little bit beyond where stem cell therapy is and talk about where the direction is that we're headed. So my name is Dr. Brady Wyrick. I'm the clinical director at Intermountain Regenerative Medicine. Our primary clinic is in Idaho Falls, Idaho. We do have a satellite clinic in Bountiful, Utah, and I'm very excited for you to be here today. Keep in mind, webinars I tend to run long because I get excited and I get talking and I talk too much. I'm going to try to keep it as concise and as short as I possibly can. I do turn off the questions, so you won't be able to respond while we're talking. The reason for that is just to kind of keep things concise, keep it on point. But at the end, please understand that I'm not a sales guy, I'm a science guy. And if you have specific questions at the end, there's going to be an offer to say, hey, you can set up a free consult with me so we can talk about your case in particular. So that is coming, but I just want to establish that there. I'm going to do my level best to keep this under 30 minutes for you guys tonight. So number one, here's the disclaimer, okay? Number one is that we're here for educational purposes only. I've already hinted at this a little bit. I'm not here to sell you anything. Again, I'm not a sales guy. I'm more of a science guy. I just want to share with you the information about where we are, where we're headed. Second thing is that stem cell therapy is not approved by the FDA, and basically what that means is I cannot sit here and tell you that it's going to treat anything, and it also means that insurance, Medicare, Medicaid, etc., does not pay for regenerative medicine. So we will talk about cost in here in just a little bit. So next thing is Intermountain Regenerative Medicine is a medically integrated clinic. So if you Google my name, Dr. Brady Wyrick, you're going to find out very quickly that I am a chiropractor, even though I do not practice anymore. My whole purpose is education. I'm here to teach. I'm here for you to understand what your options are and help you and your family make the best decision of what's best for you. Last thing is that we utilize stem cells that are derived from donated human umbilical cord. I got an email just yesterday saying, where do the stem cells come from and why don't you use your own? The answer is pretty quick and concise. The stem cells come from donated umbilical cords from healthy moms, healthy babies, live births here in the United States. They come from tissue that 97% of the time that tissue gets discarded, gets thrown away. We can utilize those cords, we can utilize those cells. Secondly, the reason why we don't use your own is because your own stem cell may be a viable option for someone who's under 50, but the older you get, the less effective your cells become. And so what ends up happening is you actually pay more for cells that are less effective when you use your own stem cells versus when we use them from umbilical cord cells. They come from the newest, most robust source that we know about. So that's the disclaimer. Hey, now what we're going to do is we're going to jump right into this. Normally, if you come to one of my seminars, my live in-person workshops, we talk about some different stories. We share some stories about success stories. I'm not going to do that a lot today, other than just talking about my dad, because this is the case that I cared the most about. Clearly, it's my own father. His knees were basically bone on bone, and he was not functioning very well at all about 2 years ago. So when I first got into regenerative medicine, I was sharing with him what we were doing, and he finally he agreed to do something that I told him after years and years and years of begging him to make lifestyle changes. He finally agreed that injections were a good thing for him. And it was. So we went from dad having to have 2 bone-on-bone knees that were scheduled to be replaced to not needing a replacement surgery at all. That was over a year and a half ago, and he's still doing really, really well. I've got a video here that I'll show you. This is my dad. This is about 5 weeks after his injection. So check this out. There he goes on his bike. And one of my bike buddies pointed out to me that he's actually pushing a very big gear when he does that, so it means it's hard to turn those pedals over. So to me, going from dad being very barely mobile to that, I think is outstanding. So let's just get into it. What is a stem cell? The best definition that I've been given about a stem cell is this. We call stem cells blank slate cells. And what that means is that right now, inside of your bone marrow, inside of your fat tissue, are your own stem cells. They are blank slate cells that are literally sitting there waiting for your body to get injured or stressed. And when they get activated, what they do is they go to where the body needs them to go to become what the body needs them to become. So if you think about a blank slate, you take a blank piece of paper. Hey, what can you do with a blank piece of paper? Literally anything you want. You can design a rocket ship. You can write a note to a loved one. You could fold it up in a paper airplane. It is a blank slate that could do anything you want it to do. So there's a lot of misconceptions about stem cells, and people will talk about stem cells that come from aborted babies and embryos. We're not using those. Hey, that's not legal. You cannot do that in this country. And one of the reasons is because those stem cells are completely undifferentiated, meaning they can become any type of cell, including cancerous cells. So we don't use those at all. But when they become adult stem cells, that's when they become a multipotent cell. An adult stem cell, keep in mind, is a stem cell from an umbilical cord on. So after the baby's born, the stem cells inside of the umbilical cord are actually adult stem cells. I know it's a little confusing, but here's a great article that I love. Stem cell paracrine action and tissue regeneration. Stem cells have emerged as a key element of regenerative medicine therapies due to their inherent ability to differentiate into a variety of cell phenotypes, thereby providing numerous potential cell therapies to treat an array of degenerative diseases and traumatic injuries. So what that means is that stem cells can become a lot of stuff. And I love this chart. So up here at the top, we have a mesenchymal stem cell that can become bone, cartilage, muscle, bone marrow, tendon, ligament, adipose, connective tissue, etc. So they have this potential of becoming a lot of different things. And what we're finding is that if you take an osteoarthritic joint and you inject stem cells into that osteoarthritic joint, they can actually become new cartilage. They can break down bone spur and become new bone. They can repair tendons and ligaments, even specific ones like an MCL tear. They can repair those ligaments as well because their inherent ability to follow inflammation to its source, knock that inflammation down, and regrow and regenerate new tissue. So that is the chart right there that changed my entire career. Okay? This is big for me. So you take a case like my dad's. All right, so you got bone-on-bone knees, you've got cartilage worn away, you've got meniscal tears, and you inject these stem cells. Number one, they're going to head to the source of the inflammation. Number two, they actually start to calm the immune system down. And number three, they start to regenerate and regrow new tissue. And we're going to show you some x-rays of what that actually looks like. So I think that's pretty cool. So here's a chart that I throw in here just to help you understand why using your own stem cells may not always be the best option. Now, it is an option, and I think it's better option than using medication because it can actually repair and regrow and regenerate new tissue, but it's just an option. Okay, so check this out. 1 out of every 10,000 cells, when you are first born inside of your bone marrow, 1 out of every 10,000 cells that you have is a stem cell. So moving on through life, when you get to be a teenager, only 1 out of 100,000 cells is a stem cell. You get all the way out here to age 80, and then you probably can't see that. My picture's going to be right over that. 1 out of every 2 million cells is a stem cell. So as we age, our number of stem cells drops off drastically. And if we have some sort of stressful event happen to us somewhere on this timeline, then what's going to happen? You're going to use up your stem cell reserves and you won't be left with very many of them. And when that happens, you see these people that decline very, very rapidly. So that does happen. And these are the people that you see when they get injured or sick, they all of a sudden start aging really, really quickly. All right? So moving on. This is actually a patient of a friend of mine that walked into my friend's clinic. This is a 54-year-old man. And he had some previous football injuries from years and years and years ago that ended up wearing out his cartilage. So when you start to hurt, what is the typical thing that you'll do? you're going to reach for anti-inflammatories. What I'm going to do is I'm going to reach for my battery, my computer cable before we lose my battery. Sorry about this. So when we get injured, what we will typically do is we will reach for those anti-inflammatories. We're going to reach for those drugs that are going to help us get a little bit of results, like ibuprofen, Advil, Aleve, etc. When those drugs stop working, we'll go to the doctor. The doctor will take an x-ray, and the x-ray might look something like this. And we say, okay, that's a bone-on-bone knee, because the top part of the knee and the bottom part of the knee, the difference between the two is 2.8 millimeters. So then the doctor will say something along the lines of, wait till you can't walk anymore, and then come see us and we'll replace it. So here's what it looks like. Okay, typically the medical route includes lifelong drugs, therapy, replacement. So when you start taking those medications, you're not going to get off of them. You're going to be taking those or something stronger or more of something stronger for the rest of your life, regardless of therapies that you do, regardless of replacement surgeries. But this is the gold standard that we have right now. Okay, so if we introduce regenerative medicine, then what we need to start looking at are things like PRP. PRP is called platelet-rich plasma. This is a process where you take your own blood, you put it into a centrifuge and spin it down. And all of the solid cells like red blood cells, white cells, etc., they're all going to settle out to the bottom, and they're going to leave you with the plasma at the top. That plasma is full of platelets that contain growth factors that can help to start to regenerate and regrow new tissue. PRP is awesome. It is something that we offer in our office. But what we see is we see short-term gains with this. So we may see a patient that will come in, and younger patients will typically respond better to this. They'll come in, they'll get injected, they'll have awesome relief for 6 to 18 months. And the reason why it doesn't last is because there's no stem cells there to actually regrow and regenerate and that new tissue and that new cartilage. Now, I know I'm talking a lot about knees. I'm not ignoring hips. I'm not ignoring shoulders, elbows, ankles, backs, necks, etc. I'm just talking joints in general. Okay, so PRP, short-term gains, but there's no stem cells, so they're not going to last quite as long. That takes us to autologous stem cells. Autologous stem cells is where you use your own tissue. Again, we don't do this because it's not as effective as mesenchymal stem cells from umbilical cords. There are higher costs involved because of collection, and there's more recovery time that's involved because they have to drill them out of your hip or take them from your fat tissue. So they're limited in effectiveness depending on how many gray hairs you have. I put that in there jokingly, but I'm serious. They're limited based on your age. The older you are, the less stem cells you have, the less robust they are, the more inflammatory markers they have, the less chance they have of working. Now, I think that autologous stem cell therapy is a whole lot better than the medical route, and if you feel like autologous stem cell therapy is right for you, please go do it. In fact, if you want to know someone in your area that you want to go find out if you can do it, let me know. I'll refer you to people. But it is more expensive and less effective than this technology that we have available. Placental stem cells. So now we're starting to talk about allogenic stem cells, or the stem cells that come from donors. You can get them from the placenta. Placenta cells are a lot like PRP, where they have short-term gains, but they have no stem cells, so we don't see as many long-term results. Then we need to talk about these mesenchymal stem cells that come from the umbilical cord matrix. Now, again, we are talking about donated cords from healthy moms, healthy babies, live births, right here in the United States. 97% of this tissue gets discarded. So this is tissue that otherwise would have just been thrown away. But if mom and baby pass the FDA's guidelines and are capable of donating their tissue, we have labs that can take that tissue, They take it specifically from the umbilical cord matrix. So if we have the umbilical cord, we have two arteries and a vein going through it like this. All of the tissue surrounding the arteries and vein are all there to help support those cords, but they're also there to help with inflammatory responses, immune system responses. Hey, those are the stem cells that we're capable of using. So the labs can take those cells, they can wash those cells, they will screen them for safety to make sure there's no chance of communicable disease coming from, I should say very, very minimal chance, like 99.999% chance, sure, you will not get some sort of communicable disease from those cells. We can take them, inject them into an osteoarthritic knee, and see results going above 90% of the time in otherwise generally healthy people. But when you take these mesenchymal stem cells and you combine them with PRP, that just means results, results, results. PRP, so with mesenchymal stem cells, people typically won't see results for 6 to 8 weeks, but then they can see them out to years. But if we combine them with PRP, it gives those cells a little bit more guidance. We see results a lot quicker with effects lasting, again, out years to years to years. Hey, so this is that same knee. Remember, I'm not going to click all the way through. That same knee, 2.8 millimeters. They get injected. They put 1 million stem cells, 1.1 million stem cells into that joint space. 4 weeks later, that joint space is all the way to 5.3 millimeters. So we went from 2.8 to 5.3 in 1 week. I said that wrong. One injection, 4 weeks. 8 weeks after that injection, that space is all the way to 6.1 millimeters. And the question I ask is why? And the why is because these cells are regenerating, they're growing new cartilage, making these joints very, very, very happy joints. Because if you've got cartilage and you've got cushion, you now have avoided knee replacement surgery or joint replacement surgery, and you now have a mobile joint. So here's what it looks like on the radiograph. Hey, the first one was at 2.8 millimeters, the second one was 5.3, the last one's at 6.1. Here's what that looks like in a paper. Hey, intra-articular injection of mesenchymal stem cells for the treatment of osteoarthritis of the knee, a proof of concept clinical trial. 18 weeks after the injection of, 6 months after the injection of these individuals, the size of their cartilage defect decreased while the volume of the cartilage increased. In other words, they grow new tissue. Hey, here's what it looks like in real life. Go dad, right? Hey, so what else can stem cells help with? Well, on a day-to-day basis, people are going to reach out to me and ask me, can stem cells help with X, Y, Z? My answer is always maybe. But what I'll do is I'll sit back and I'll walk them through the 3 things that stem cells do, or regenerative medicine does. Number 1, they're anti-inflammatory. They help reduce the inflammation. Does your condition have inflammation? Yes or no? Number 2, they are immune system modulators. They help calm the immune system down. And then number 3, they help to regenerate and regrow new tissue. This is one of our patients that came into us. His name was George. And George, this is psoriasis. So George comes in and he asks me, what are stem cells going to do? And I told him, I said, I wish it was an osteoarthritic joint, because then we have a very high probability of helping him. But it's not. This is an autoimmune disease that if you proceed forward with this, here are your risks. Your risks are that it might not work. And if you can afford to take that risk, then by all means take it. But if you can't afford that risk, then I wouldn't do it. And for George, the money wasn't that big of an issue. He proceeded forward with it. We helped him by doing an IV. These are the cells, or these are his knees the week that we did the injection. 14 weeks later, here's what his knees look like. That's pretty remarkable results considering what happened. So anything else other than osteoarthritic knees, we just need to talk, we need to do the consult, and we need to say, okay, will this help or will it not? And the answer might be no. We had a response. We had someone come to one of our seminars that asked me about one of those diseases I've never heard of, and I had to say, I'm sorry, I don't know. It's probably not a good fit for you. So that's why we just want to talk. We want to do this consultation. Here's a paper from Rheumatoid Arthritis from using umbilical cord mesenchymal stem cells. The treatment induces significant remission of disease in rheumatoid arthritis. So While there's about 7,000 studies going on worldwide, I can't promise you that it's going to do anything for whatever your particular condition is. All we can do is talk about what the factors are and make decisions based off of those factors. So, a couple of just basic questions that I get on a day-to-day basis. Again, this is my dad getting his injection from our nurse practitioner. Does it hurt? Answer is, you're taking a needle. And for some people it does hurt, for some people it's not that big of a deal. How long will it last? I'm not going to sit here and promise you anything. Hey, there are papers that suggest that it'll last 5 to 7 years from this country. There's papers from other countries that will suggest 10 to 15 years. We don't know, and it depends on how well you take care of yourself before and after the injection actually happens. Hey, what should I expect? Expect to have joints that are swollen and sore for about 6 to 8 weeks. All right, sorry, I said that wrong. Expect to have joints that are swollen and sore for about 24 to 48 hours. And then don't expect to see a whole lot of change in the first 6 to 8 weeks. But it'll take about 6 to 9 months for the effects to really kick in. But we hope to see, a lot of people will see significant improvement in 6 to 8 weeks. That's why we do a follow-up right around that 6 to 8 week mark. So is stem cell therapy or is regenerative medicine right for you? There's a few questions that we need to ask. Number one, what's your overall health status? During the consultation, I'm going to ask you about your health status. We're going to talk about your height, your weight, your medications, other disease processes that are going on. Because the more things we add on top of that, the less likely it is that this will be a right fit for you. That's why we just need to talk and say, okay, where are you at? Number two depends on your mental mindset. If you believe this is a waste of your time and money, guess what? It's a waste of your time and money. But those people that come into it with an attitude of, hey, if it doesn't work, we tried. It's not that big of a deal. Those are the people that it seems to work the best with, ones that have a positive outlook on this whole thing. And then lastly is the financial part of it. I promise you we're going to talk about what they cost, and here we go. Okay? Now, PRP. So if we're going to do just PRP, this is typically for younger patients with joint issues, but PRP starts at $750, and then you add about $125 per joint that you do. So $750 is for the first joint, and then adding additional $125 for additional joints after that. Stem cell therapy comes in cc increments. So 1 cc for stem cells is $42.50. That includes PRP. To me, this is the way to go because this is where you'll see the biggest results for the longest period of time. 2 cc's, it goes up basically $2,500 per joint that you do. Now, our payment options, because insurances don't pay for this, they are cash, check, or credit card. You can use your health savings account. You can use your flex spending account. There is some financing options that are available. You can use those as well. Now, so that takes us to the question, what's next? This whole time you've been seeing that button down by me that says book your appointment now. What's next is to click that button and set up the consultation. Hey, again, we are not going to charge you for this consultation. It'll be over the phone. We just want to discuss your areas of degeneration. We want to talk about what strategies we're going to use, whether that's intramuscular or via injections. We're going to talk about the cost options, make sure all of your questions are answered. Having your spouse involved is important. They need to know what's going on if you have one. And then scheduling and timing is important too, because we run a pretty tight ship where we're probably about 4 weeks out from being able to do anything most of the time. These next couple of weeks, though, we've added some times just because, well, I'm going to show you why in here in just a second. Hey, so all of this is important. We're going to talk about this during this consult, so that's what that button's for, but don't hit it yet because this is what we need to talk about. Okay? Our lab contacted us this week and offered us big discounts until the end of the month. Okay? They say, that's what I'm saying, for a limited time, there is a 10% discount as per our lab for any injection that you do. So if you do 1 cc for the stem cells, so that's a $420 savings. If you do 2 cc's, that's a $670 savings. But this is only for a limited time. This is only till the end of the month. So what you need to do is to schedule your consultation right now. So click on that button and we'll get it scheduled. You can do that on the phone or you can do it in person. Keep your appointment. So when I call, what I typically do is I will call from my cell phone. So you'll get a call from an Idaho Falls number. Make sure you answer it when we call. And number 3, you only got a couple weeks to act. Like I said, this is a very limited time that we're going to be able to do this 10% discount. So just bear that in mind. So guys, I appreciate you. Thank you so much. I've kept it under 30 minutes, which is a miracle in itself. But click on the link. Let's get that the consultation set up so we can talk. We can get this ball rolling for you. Thank you very much. We will talk to you soon. Thanks.